My name is Chase Gibney. I'm the Enterprise Director of Environmental Services for the University of Kentucky. I'm responsible for all of the inpatient, Eastern State, and ambulatory environmental services departments, supporting their day-to-day operations, making sure that they're meeting expectations. We're meeting federal, state, and local guidelines, CDC recommendations. We're used to dealing with these high acuity patients. We see the sickest of the sick. We see a lot of, the bad bugs, the resistant strains. So we're used to dealing with that on a day-to-day basis. And we have a hazardous communicable diseases team, which we drill for this. So we're pretty experienced with dealing and training for this. So we kind of sprung into action and we started redeploying our teams to really look at some of the common spaces, make sure we're hitting those high touch surfaces. Those are going to be things like call lights, they're going to be your telephones, your computers, your seating areas, your light switches, restrooms, that type of thing. Those are typically the surfaces that are going to pose the most potential of risk for infection. So we really wanted to ramp up our frequency or volume of cleaning of those. We wanted to make sure that we were limiting exposure for transmission. So we started adjusting, the number of staff that were coming to various units that were potentially high risk, ramped up our public spaces cleaning with disinfecting our furniture, ramping up our terminal cleaning process. But a lot of it was really just geared around making sure we were getting added service frequency. And then we also partnered with our nursing teams to make sure they were helping on. They've been more than happy to kind of go along and say, oh yeah, we gotta take care of this too. We're all in this together.
So we've always had a very high standard for cleanliness and sanitation here at Chandler, the clinics at Good Sam, anywhere in our UK enterprise. But particularly right now, we've been spending so much time with our frontline staff, educating them, really empowering the housekeepers to understand what's going on and being able to take care of the sanitation practices. In addition to that, we've just really stepped it up as much as we can, redeploying my hospitality experience team to not be just visiting the patients, but to be sanitizing every aspect of this hospital. So I can confidently say, and I'm very proud of how our frontline staff has just really stepped up and sanitized, every surface of this building at all times.
We call ourselves an enterprise, even though we have multiple sites across the city. We refer to ourselves as one organization. So within the Environmental Services Department within UK, we have roughly 400 to 420 associates, depending on the time of year and volumes, roughly 40 managers, and we cover, I think, just shy of 3.4 million cleanable square feet, which does make us one of the largest institutions in the country as far as that goes. Typically, we'll do anywhere from 200 to 250 discharges. Before, this was pre-COVID, when we were at the peak of flu and our volumes were somewhat normal. We're cleaning 1,000 patient rooms to 1,200 patient rooms a day across the system, including our mental health facility, Eastern State Hospital. So, at any given time, there's probably 150 to 175 associates across the system on any given shift.
I think our team has done a really great job. Of a lot of our frontline associates, really stepped up to the plate. No one wants to prepare for a pandemic, but essentially, yeah, that's our job. So making sure that we have things like PPE and chemicals and the staff and manpower to handle these situations. I think UK has done a great job with that. We are screening every day when our employees come in. So they have a health questionnaire that they answer every day. You're also made sure that you are fitted with the proper surgical mask to have around the hospital. So they're doing a really good job of staying ahead of things.
We have a very expensive 10-step cleaning process where we go in and we clean from the top to the bottom, and we clean your room every single day. So that's always been a standard here. Every single room, every single day is cleaned.
Coming here, you're always in a safe environment. Everyone is so hyper attuned to this that the risk is going to be significantly less than if you're out in the general public.
Weeks ago, they made adjustments to our public spaces who we're allowed to have in the hospital, and even things as small as the cafeteria. They've taken out tables, reduced seating, limited amount of people allowed in. So they're really trying to prevent. It's all preventative measures that we're taking to keep people safe. And I think that they've done an excellent job at that.
As I've been rounding, especially the past few weeks when our visitor guidelines and things had changed, the first thing I heard from our staff was, I've just been spending a little bit of extra time in the rooms because not only do I want to make sure they understand that I'm sanitizing to the best of our abilities and keep them as safe as possible, but they don't have any visitors and I want to be able to talk to them. I had a brand new associate yesterday who said, I just really focused on making a connection with every single one of my patients. And he had 20 patients that day. And he could tell me a connection he made with almost all of them.
We are experts at this. This is what we do every day. We protect the public from infection, from disease, and with the added resources and all the team members working together to make sure patients are safe, that we have the products, we have the training, we have the experience, we have the best practices, and we have some of the best people in the country here that are making sure that this place is the best that it can be, that it's the safest it can be.